luck.
Good morning, everyone, and welcome to Crisis Services live on Facebook this morning. I'm joined by Celia Spicone, and we're here to honor World Suicide Prevention Day. I am the CEO of Crisis Services and also chair of the Erie County Suicide Prevention Coalition. And I'll let Celia introduce herself a little bit as well.
Good morning. I'm Celia Spicone, and I am the coordinator of the Suicide Prevention Coalition of Erie County, and delighted to be here with you this morning.
So we're doing a little bit of a different format today. Usually this day every year we would hold a press conference with all our partner agencies and other community supporters. But with our COVID edition here, we're coming to you live via Zoom and looking forward to sharing some messages of hope today as we get started. So I'm going to have actually Celia start briefly to talk a little bit about our coalition, the membership, and also some of the goals and efforts that we're working on.
Great. Thank you, Jessica. September is Suicide Prevention Month, and the coalition is very much involved with supporting this and getting the word out. And September 10th, today is World Suicide Prevention Day. This is organized by the International Association for Suicide Prevention and is co-sponsored by the World Health Organization. The key message is to raise awareness that suicide is preventable. Together, as a community, we can work to prevent suicide. And even in these challenging times, we need to stay connected to each other, be aware of who is hurting, reach out, and get help for those who tell us they are suffering. The Coalition of Erie County, the Suicide Prevention Coalition of Erie County, is 38 members strong now and growing. We're a group of mental health providers, stakeholders, schools, universities, colleges, in general, people in the community who work voluntarily together to increase awareness about suicide and prevention, provide education, resources, and give a vision of hope for our community.
Great. Great. And we're, really excited to have such a collaborative group that helps us with all of the efforts that go on in Erie County around suicide prevention. It's really takes, as they say, it takes a village, and we have such an amazing group of people that are committed each day, not only in their day-to-day worlds of their work and their jobs, but volunteering and really helping to bring more awareness and prevention to save lives here in our community. So as I started, we had to reimagine how we were going to do this today. Usually we're down at the Rath building with our county partners who, highlight today, but also the message of hope here in Erie County to really make sure that our community residents know we're here, that we care, and we really want to help people in that moment of crisis to find that hope that sometimes can get lost, especially in those distressed moments. So, but what we're going to be doing is sharing these messages of hope from our county partners with you today. So we're going to first start off by sharing a video with Mark Polenkar. So hold on as I transition here quickly and get his video set for everyone to watch. This is the fun of technology these days. So give me 1 second. Here we go.
He's always been
Executive Mark Polenkar with a reminder that September is Suicide Prevention Awareness Month. Unfortunately, suicide takes many lives in our community, many more than there should be. We all need to know the warning signs with regards to suicides. I lost a friend to suicide a few years ago, and it completely surprised me, but then I looked back and thought maybe there were some warning signs I missed. We need to come together and realize that you can prevent a suicide. Don't be afraid to ask someone if they look like they need help. and always, always be there as a friend for someone in need. We've been very good the last few years, not having as many suicides as prior years. So let's continue that by ensuring that during this September Suicide Prevention Awareness Month, we do everything possible to help those in need. Thank you.
That's great. I want to thank, our county executive has really been a great voice for mental health, especially during the time of COVID here. And we can talk a little bit about that through our program today. But he really sharing his own personal, oh, I'm sorry. Sorry. We're showing another press conference. That's not, I apologize for that. But just really appreciate his support every year with this day and this month and really highlighting suicide prevention. And I know he shared his own personal story of losing a friend a few years back and, talked about some trying to be paying attention to what are those warning signs and what are things people can look for. But Celia, could you share a little bit about what that could be? What are we looking for somebody who might having thoughts of suicide?
Sure. I appreciate that. Coming from a personal experience, which so many people have, you are more aware of these things. The warning signs that we talk about, we tend to group into three categories: talk, behavior, and mood. So if you hear someone saying something about ending their life, or I'm always concerned when I hear someone say, I feel like I'm a burden, or you'd be better off without me, or that they feel trapped, or the pain that they're in, and that pain can be either physical or psychological, is unbearable. They feel they're at a point that they can't take it anymore. Those are concerning statements. In behavior, we always are a little worried when we see things like people drinking more than usual, because of course alcohol not only reduces your inhibitions to act, but it's a depressant. So that's a concern. People having trouble sleeping, acting recklessly, not engaging in the activities that they usually do very freely, like sort of socially isolating, even more than perhaps you have to in the COVID environment, and not being around their family and friends, not taking care of themselves, or of course, very concerning is someone who's you see on the internet looking for methods to take their life. In terms of mood, what I try to say to people is look for a change in mood. So from someone's typical pattern, someone who's usually bright and cheerful becomes down, depressed, or even agitated. It's not depression doesn't always manifest as that sort of sad down look. Someone can seem angry and agitated as well. So if you see a change from someone's typical mood, it's a time to be concerned and to reach out, have a private conversation with the person. Talk to them. What's going on? How are you feeling? Ask directly if you're concerned. Ask directly. Sometimes when people are saying some of the things that you're saying, they're thinking of taking their lives. Is that what's happening for you right now?
Right.
And feel free to do that and then to connect somebody. And we're going to talk, I know you'll talk more at the end about how to connect somebody to services, because that's the biggest thing you can do.
Absolutely. Absolutely. And I think just at this time, with the layer of COVID and some of the challenges that it brings with not having the same access that people might have to family, friends, or some of the other what we would refer to as protective factors, things that make them feel better, and activities out in the community, it is limited. So it's a very interesting time when we're talking about signs and symptoms to really pay attention and balance and understand kind of for people that were already vulnerable. This layer of COVID and the challenges that it brings could make them more vulnerable. So really having those conversations and just being comfortable in the uncomfortable at times to ask those questions is really important and can really have life-saving effects for our community. So okay, so the next video we want to share, another community partner of ours is Dr. Gail Burstein, and she's been a great advocate for the Suicide Prevention Coalition. And so she want to share her message with everyone today. So just give me 1 second.
Hi, I'm Dr. Gail Burstein, the Erie County Commissioner of Health. September 10th is World Suicide Prevention Day, and suicide is an important public health issue. From a public health perspective, we want to do all we can to prevent deaths by suicide, and we all have a role to play in this important public health effort. The International Association for Suicide Prevention is calling on all of us to take a minute to reach out to someone in our community, family, friends, colleagues, or even a stranger, especially if you notice something different about them. Uncontrolled anger, withdrawing from family and society, anxiety, dramatic changes in mood and sleep patterns, and reckless or risky action are all signs that somebody is in distress. You don't need to have all the answers to help someone in need, and you don't need to know what to say. You just need to listen, to be available, to show your concern. The simple act of empathy and compassion can prevent a tragic loss. Now, more than ever, we need to look out for the health and safety of others. So just take a minute to reach out and start a conversation with someone in your life who may be in a vulnerable spot right now. And if you feel like you or someone you know are in crisis or are having thoughts of suicide, as a solution, please call Crisis Services of Buffalo and Erie County Crisis Hotline at 716-834-3131. Help is available every day, 24 hours a day. Thank you. Hi.
That was a great message.
Oh, yes.
Really, I think, yeah, she's just been such a great advocate for us. So I do appreciate, her message of, that this is a health issue. We talk about mental health, but it's really about just health in general, and how important it is to communicate and share how we're feeling so people can get the help that they need. And I know that, as we're looking at our prevention efforts, the issue of this being a public health issue in a crisis is really been risen in our communications, I think, as professionals in this field, and also just how suicide is looked at, because, there's a lot of different ways we can analyze and understand the experiences of those that we've lost, but also those that have attempted suicide, and survived, to hear their stories so we can better improve our prevention efforts. And I know one of the things that we're working on here at Crisis Services and partnership with the coalition, was the implementation of a suicide fatality review team. And this is a group of stakeholders that are coming together to review our suicide deaths in Erie County. And family members will be contacted to participate in this effort. And I think it's going to help us really evaluate points in the system, our continuum of care, where other prevention efforts can really be put into place. I think training is a big piece, and that's something the coalition does regularly, is to really pay attention to what are the signs and symptoms, what to do to reach out, and what help is available. But I think the more and more that we're all collectively aware of suicide, regardless of discipline or assumptions that only this group deals with this and we don't deal with this, I think the more we become universally aware, and also look at it as a health issue, I think that more we'll have some more successful prevention efforts that come from our reviews, but also ultimately our goal is to reduce the losses that we see on an annual basis. So I think what's important, though, to highlight for Erie County, and we've been really monitoring this, especially during COVID, because there was a lot of conversation at the start of COVID that there was going to be a spike of suicides. And, that, was concerning and alarming to us in the field. And we really wanted to be conscious of that, pay attention to that. But I think what we're seeing is the continued efforts that this county has put in place and the providers that we have in this community. We've been able to maintain, and we haven't seen a spike in our suicide deaths. We've had suicides, but they're kind of ranging in the same numbers that we've seen previously, and actually a little bit lower than previous years. So I don't know, Celia, if you have any comments to that, because I think it's important when we see national headlines or we see, kind of larger conversations beyond our community. We do have to strike a balance about what's happening locally and what we can be honoring that's working well to save our Erie County residents.
Mm-hmm. No, I think that's a good point, Jessica. And I was worried when I heard at first people saying suicide rates are going to, number COVID deaths, suicide rate increases, because we have an issue, with self-fulfilling prophecy. And we don't want people to think that this is a way to cope with COVID. A lot of the education and the work that's being done in Erie County is paying off. People, I think, we're a good community. We help each other, and we will help each other through this. We have to keep our hope alive and our resilience, which I'm going to mention a little bit more later as a way to try to get through the pandemic. And I just wanted to say one thing about the suicide fatality review team.
Mhm.
This is we had our first meeting yesterday, and some people who may be watching may have lost someone recently to suicide and may be approached to participate. And the team was so respectful and caring in their review. And this is a way that will help us to know what kinds of systems changes we can put in place in Erie County. And, your leadership with this has been tremendous. It's, this is not happening everywhere in the country. It's happening in a very few places, and it's a great opportunity for us to learn some ways to focus our limited resources to be more helpful. So I hope people are willing to participate. It's done in a very respectful manner.
Absolutely. Absolutely. Yeah. It was our first meeting yesterday, as Celia mentioned, and I think and we had one case that we reviewed, and I think it brought people together who have worked together for a long time, I think in a different way. And I think it helps us to maybe open up, depending on the discipline you represent, a different perspective of how to look at the role that discipline can play in preventing suicide, and what are questions we could be asking or other information we can be gathering that might help us learn sooner before someone reaches that crisis point. So yeah, I am very interested to see how this takes us to the next level of our prevention efforts here for the community. So I'm glad that, and I thank the team. They've been a great team to work with on this. So, and Dr. Burstein has been a big supporter since we brought this concept in a time that is a very busy time for not only the Department of Health, but also our medical examiner's office, who's a huge partner with the coalition to help us really understand the stories of those that we've lost to suicide. So I do want to give a shout out to both Dr. Burstein and also Janine Blank from the medical examiner's office for their help and support. So, so our next video we wanted to share with you is a video by Commissioner Mark O'Brien. And Mark actually is the Commissioner of Mental Health and actually just joined us in the midst of COVID. So what a way to start his tenure as commissioner in the midst of COVID and really focusing on mental health. But Mark comes to the table with such amazing experience as a social worker and his own history in the field. And so I'm going to share with you here his message of hope today. Give me 1 second. I apologize here.
Hello, my name is Mark O'Brien. I'm the Erie County Commissioner of Mental Health. September 10th is Worldwide Suicide Prevention Day. Erie County is a proud member of the Suicide Prevention Coalition, whose mission is to bring awareness and hope to the public that suicide is preventable. We're showing progress with a decline in the number of suicide deaths in Erie County. This is contrast to the national data, which is showing an increase. Over the last 5 years, men have accounted for approximately 75% of the deaths by suicide in Erie County. Statistically, women are 3 times more likely to attempt suicide, but men are more likely to complete suicide, with the highest percentage being in the 55 to 70 age range. Why are men in the middle years such a high-risk group? Cultural expectations about masculine identity influence behavior. Mental health and substance abuse disorders are major risk factors for suicide among men. Men are less likely to seek mental health treatment than women. Men tend to use more lethal means when they attempt to take their lives. Last year in Erie County, about 30% of suicide deaths were by firearm. However, there's been a noted increase in the use of firearms for suicide by women over the last several years nationwide. The Suicide Prevention Coalition of Erie County has taken on a project called Means Reduction. The goal is to inform firearm owners of the importance of keeping all firearms locked when they're in the home. If someone is in crisis, guns should be removed or disabled. Last year, the Suicide Prevention Coalition of Erie County launched their website, mengethelp.com, with stories of local men and their personal experiences and resources directed specifically to men. If you know someone or may be contemplating suicide, please encourage them to talk and to call Crisis Services at 834-3131. Thank you. Hello.
Oh, sorry.
You're doing great, Jessica. I'm impressed.
I tell you. It is something doing the transitions with the videos. I'm learning a lot. I feel like I'm getting more tech savvy as a result of COVID. I think we all are.
Mm-hmm.
So appreciate everyone's patience with my transitions. But so Celia, I think Mark made some really good points too about the efforts that the coalition is working on to address men who are our highest risk group here locally as well as nationally, but also some of the work around means reduction. So could you talk a little bit about those efforts?
Mm-hmm. So means reduction comes out a whole body of literature. We always look at, why someone takes their life, but now they're realizing that looking at how can have an impact as well. And the big factor with that is to put time and distance between a person and the method that they choose to end their lives. So every year we try to focus on some of our efforts on one project, and this year it is means reduction, looking at the method that someone uses to end their lives. Suicide can come after a lot of struggle and pain, but it's often a somewhat impulsive act for a person who has been struggling for a long time. And the average length of time between a person actually thinking that they will take their life as their solution and acting is often just less than 10 minutes. So, and these things sometimes can happen in the heat of an argument or a crisis. So, a critical way to reduce the number of deaths is to avoid having a lethal method readily available in the home. And firearms are a leading method for suicide and, unfortunately, the most fatal. So we're working with firearm owners locally to help them realize the importance of keeping their firearms locked in the home. And during if there's anyone in the family or who may be coming into the home who's in a crisis, remove them temporarily or at least disable them when this time period is occurring. We're concerned as well because at the time of the pandemic, it's added risk. People are not only socially isolated, but we saw a rise in firearm and alcohol purchases, and that's a potentially lethal combination. So we're working together with the local VA here in Buffalo and the local chapter of the American Foundation for Suicide Prevention. And at the Department of Health COVID testing sites, we're giving out materials about the importance of keeping firearms locked. We were going to gun shows, but those are not happening now. So we appreciate the partnership with the Department of Health, Erie County Department of Health, And we're even giving out free gun locks to anyone who would like one. Take it home, use it, keep your guns secure. We have a project now too, working with local gun shops to develop an easily available map, which will show free, low-cost, temporary, voluntary storage options. So if you are in a crisis in your family and you have a firearm, you'd like to get it out of the house for a while, but voluntarily, not have it removed by any law enforcement or agency, but voluntarily put it in storage. We're going to have a resource that we'll be putting up, which will show you all the gun shops who are willing to do it and how much it costs. And typically, there's no process you have to go through when you decide that you're safe or your family's safe, and you can go back and get your firearm and return it to the home. So this, I think, is something that people can use to keep themselves safe. The other thing we're doing is there's a nationally recognized training program called CALM, Counseling on Access to Lethal Means. And we are providing that to mental health professionals here in Erie County so they can learn how important means reduction is and learn how to respectfully have those conversations with their clients and families. The basic message of means reduction is keep your home safe. Keep firearms locked or removed during a crisis. Only have medications in the needed quantities that you have. And keep dangerous medications locked. There's no reason to have, the old medicine cabinet, you open it up and 10 bottles of pills fall out.
Right.
Because in a crisis, that's not helpful to have. Yeah. So that's what we're working on this year, to try to keep Erie County a little safer.
Yeah, and I think with the focus on firearms, although we know various statistics around the use of firearms as a means, it's been an interesting process for us as we build those partnerships with the gun shops and the different the gun groups, and just kind of everybody has safety in mind, right? That we're all working towards safety. So I think it's been really neat to see and watch that relationship building evolved by the coalition, and also helping us to really kind of share that message of hope in maybe unexpected places that people weren't thinking would be, especially like images or messages or brochures or posters too that will be coming with some of the gun shop owners that will be involved with this project. So it's a great effort, and I'm really excited for our community to have these options, because I think that's in order for people to have choice in what is the best way to keep themselves safe and their family safe. So that's going to be an exciting outcome from that. And, we'll be sharing more about that project through Crisis Services social media. Also, the Suicide Prevention Coalition has their own website, which is suicidepreventionecny.org. And we'll be sharing information on our homepage there about this effort as it gets finalized here shortly. And you'll be able to receive that information. So that's great. Anything else on means reduction you wanted to touch on at all for our viewers?
No, I just want to say one thing though about a protective factor that overrides all of this, and it's resilience. And during these challenging times, we all need a little bit of resilience, a little bit more. So how do you build that? How do you get that umbrella over you during our challenging times? And one is to get connected, with family. Look up an old friend, call people. We're all using Zoom. Use it to connect with people you haven't talked to in a while. Try to make every day meaningful in some way. And ask yourself, how have I challenged myself? How have I survived other challenges in the world that I experienced? And use those same strategies to get through this one. Remain hopeful. And most importantly, take care of yourself. 3 things: sleep, diet, and exercise are absolutely critical. The importance of getting a good night's sleep can't be overstated. Don't try to short circuit that because you're busy and doing things. Have a healthy diet. A lot of people are actually using this time to get their diet in a better place because they're not eating out as much, perhaps, or
Right. Have more time to cook than, you're not commuting back and forth to work or other things. Yeah, it's been an interesting moment to see those things maybe changing for people.
Right. And there aren't as many social things to do, but, taking a walk, exercise is still there. So, those are things that can help you be healthy and resilient during this crisis.
That's great. It's a great reminder. Resilient. We sometimes don't realize our own power that we have within us, and we have to just remind ourselves of that and reflect back. I think it is an important reminder that if in that moment today, if you are having a hard day, to think back, okay, what got you through a hard day before, and pull back on those things that worked well, because sometimes it can be forgotten pretty quickly. So it's just taking that moment to reflect and remember your resilience and kind of your power within to keep yourself safe and find that hope that you might need to get you to the next day. And there's a lot of people in this community that care. And like I said earlier, at the end, we'll talk a little bit about crisis services and the role we can play to help you and your family if you have some concerns for anyone who's suicidal. So with today's World Suicide Prevention Day, as we mentioned, we would usually be down at the Rath Building, and the press conference that we would hold would be called the Raising of the Flag of Hope. And we will be doing that virtually. But before we do that, we wanted to share a little journey that our flag took over the last month with our coalition members. Do you want to talk a little bit about this next piece we're going to watch?
Sure. Jessica said there are people who care about you, and you're going to see them in this video. The Flag of Hope. I guess you think of Olympic torch traveling to get to the Olympic Stadium. The flag went all over Erie County in the hands of so many people. It's going to be a little hard to recognize them because everyone's got masks on. But so many people who care about you and are willing to be there for you. And as the flag traveled around Erie County to some iconic places and agencies and places of help, it made its way to the Rath Building, where it now flies. So I think you'll enjoy it with a little musical background. And I want to do a little shout out to Amy Rockwood and her son Marcus, who did the technical work on this piece.
Yeah, it was a huge help to have Amy's son with this. So give me one
We needed
second.
a young person to do this.
So let me just transition this to our next video. Oh, wrong one. There we go.
When I am down and oh my soul so weary, when troubles come and my heart burdened be, then I am still wait here in silence till you come and sit a while with me. You raise me up so I can stand on mountains. You raise me up to walk on stormy seas, and I am strong when I am on your shoulders. You raise me up. breathe. You raise me up so I can stand on mountains. You raise me up to walk on stormy seas. And I am strong when I am on your shoulders. You raise me up to more than I can be. You raise me up so I can stand on mountains. You raise me up to walk on stormy seas. And I am strong when I am on your shoulder. You raise me up to more than I can be. You raise me up to more than I can be.
Sorry. Give me one
Hi.
second. Maybe for the next time. I always a little transition. I want to restart every time. So,
Yeah.
but wow,
Mm.
that song gets me every time. I don't know.
Mm-hmm.
But yeah, what a journey that flag took this last month with all of our members, and they really enjoyed the doing this project. Really, to be able to give their faces, which usually would be at the press conference, to the community by doing it this way, and but also to highlight all the people that are supporting the efforts of the coalition and the message out of hope to the community. So I want to thank all of them for their efforts, and Celia, for you organizing that group to do that. It was a charge for sure, but man, what a beautiful video that came out from that. And thanks again to Marcus for his techniques to get us that amazing video. So oh, that's great. So the last piece here is the actual raising of the flag. So this flag that has had a journey this past month will now be resting for a bit this month, and is actually going to be hanging in front of the RAF building throughout the month of September to honor Suicide Prevention Month. So we're going to watch the raising of the flag next. Oops, give me 1 second here. There we go. Pretty amazing, huh?
Yeah. If you drive by, take a look, and that's our message. If you've lost someone, we're so sorry for that loss. But if you're struggling, there is hope, and there's so many people who want to help you.
Absolutely. So just to kind of, I guess, to share that hope and who's available, here at Crisis Services, we are your 24-hour crisis center, and our crisis first responders are here throughout COVID, they've been here on site. They've been answering the call. They've really been giving amazing support during this time, but also just in general to help people through an even more heightened kind of scary time that we're all going through. But it's been amazing to watch all of their hard work and intervention and support that continues to help people find help, but also hope, and also keep them safe. So, and it was shared a few times through the video, the crisis services 24-hour hotline is 834-3131. We're here 24/7. I think what's important, and I just wanted to take a moment to share, a lot of times people are a little like curious about what happens when I call, and kind of trying to demystify what that looks like for people is that the counselors are just here for you. You can call anonymously for support, guidance, consultation, information, referrals for the many services. The providers you saw through that video are here and ready and willing and able to help through during this time too, with all the telehealth options that are available. So the counselors can really help navigate what might be the best options that could help you during this time. They can talk with you about safety planning. We really didn't touch on that too much today, but really it's thinking ahead before you're in that moment of crisis, of what helps you through that crisis. Who can you talk to? Who are safe people to talk to? What are the means reduction efforts you can put in place to reduce access to means during that crisis moment? And also just reminders of what are things that make you feel good and find happiness and hope. That could all be written down in a plan that could really be there in black and white for you sometimes in that moment of crisis. So those are things that the counselors can do with you on the phone and talk with you. They can help family members also. And how can I start this conversation? What can I say? What can I share with my loved one that I'm concerned about them? So the hotline number is 834-3131. And although you can remain anonymous, if somebody is at a heightened risk for suicide, we are going to want to gather as much details and information so that we can provide the best intervention and support to help save that life and not, leave them in that moment of crisis. So sometimes that work can happen right on our hotline with our hotline counselors, but we also have our mobile outreach program, which are amazing staff who go out in the community to do mental health assessments for somebody who is in a mental health crisis, who is threatening harm to themselves or others. And really our goal of that program is what we refer to as diversion from unnecessary hospitalization, as well as unnecessary jail presentation that sometimes individuals with mental illness sometimes are disproportionately represented in our criminal justice system. So we're really trying to help people find that resilience again, find those moments of hope, reconnect to services and support to really provide that safety, to keep them safe in their community with those around them that are safe and protective for them. And we're here 24/7. One phone call can help navigate that. Again, if you have questions, if you're a loved one and you're concerned, you can also call for those services as well. It doesn't have to be just the person themselves, because if somebody's safety is at risk, we have the ability to respond and help with that situation. So please call us again 24/7. We're here 834-3131. And also it's important to know we are the network center for the National Suicide Prevention Lifeline. So sometimes you might see the 1-800-273-TALK line that's advertised nationally. And that line actually comes into crisis services, and we help manage those calls for Western New York. So you do get a local connection, even though you are calling that national hotline. So we're really honored to serve that role for the National Suicide Prevention Lifeline, but also our main hotline here at Crisis Services for Erie County is 834-3131. So we do hope that, this information today, and just a reminder of the safety and support that's out in the community that cares for each and every one here, that we don't want you to suffer in silence and be alone. And I think it's important to know that thoughts of suicide happen regularly for many people, and that is okay. It's just moving from the thoughts to action that we're trying to make sure doesn't happen as part of all of the efforts we talked about today. So Celia, any last thoughts or anything else you'd like to share as we're kind of coming to an end of our program honoring World Suicide Prevention Day?
Well, I'd like to mention also that this evening, we're delighted because Niagara Falls um, and the Dome on City Hall and the Buffalo skyline will all be lit in yellow to honor World Suicide Prevention Day. So we'll have some pictures, but if you want to take a drive down and see the falls at 10 to 10:15 p.m., it will be in yellow. And all evening long, the downtown skyline will be lit in yellow. Couple events coming up in September too is the American Foundation for Suicide Prevention always has a walk. This year it's going to be like everything else, reimagined, and it's September 26th. And if you go to the AFSP.org website and look at the walk, and you can see what's happening locally here in Buffalo. They have a great event every year, and it's a wonderful way for people to get together. And this year they're going to do it a little bit differently with a lot of virtual activities and things, but it's still, I think, going to be a fantastic event.
Absolutely. Absolutely. Yeah. And it's a major fundraiser too for AFSP to be able to invest back into the community through training and research. And so they've done an amazing job to, again, like we keep using this word of reimagining how we're doing things and the creativity that has come out of that to still bring survivors together because it is a powerful day. And so to be able to still do that in a virtual way, but also to have teams still getting together and kind of doing their own types of virtual connections throughout that morning and into the afternoon for the walk, I think is going to be really important as we continue to honor those that have lost loved ones to suicide, but also bringing that awareness that's so critical for us to continue to prevent suicide. So great. Well, we want to thank you for joining us and bearing with our little transitions as we shared so many messages of hope from our community partners, as well as our coalition members and all of us here at Crisis Services, just honoring World Suicide Prevention Day, really providing some sense of hope for our community, but also remembering those we've lost and really honoring their memories in our work. So that we can continue to find and improve the ways that we're preventing suicide here in Erie County. And I want to thank Celia for all her hard work as our coordinator of our coalition that helps to keep us moving together in a real collaborative and collective manner to make these efforts successful. So I want to thank you for all you do and your partnership with me each and every day here at Crisis Services. So thanks again, everyone, for joining us. Please talk to each other, check in with each other. Just a simple, how you doing? Are you okay? I've noticed, something you seem a little off or something a little sad. Simple questions can start an amazing conversation that might help to save a life and a loved one near you. So please call us too at 834-3131. Thanks again, everyone, for joining us. Have a good day.
Thank you.